Hello, welcome. I am John O'Brien from the Keystone Contractors Association, and on behalf of the KCA Safety Committee, which I see none of them are here right now. So they obviously are on job sites making sure the KCA job sites are nice and safe. But rest assured, everything will be recorded, and I will get this to the gang and get it out to the industry afterwards. But on behalf of the KCA Safety Committee, I am excited about today's program. We have two excellent presenters and speakers, very knowledgeable. And today's program is titled The Importance of EAPs, Employee Assistance Programs. And we are in excellent hands today. Our speakers today are Jessica from M&S EAP and Kara from Houck, which I love the new saying there, honor, humility, and health.
And
So
health, yep, those are our
that's
values.
awesome. Great values, great presenters. I'm really looking forward to it. I'm gonna go off screen, mute myself, but if anyone in the audience has questions, feel free to raise your hand, put it in the chat. Kindly interrupt the speakers as they speak. Anyhow you want to get your question out there would be awesome. So I'm really looking forward to it and take it away.
Thanks, John. My name's Jessica, and I've been with the Employee Assistance Program for several years at this point, and I started as an account manager. My job was to promote the EAP and increase engagement and utilization. And these days, I am busy with training and development. So I train on a variety of topics, and I always try to insert a shameless plug for EAP because it connects to so many of the topics that we discuss, and it is a super valuable benefit that is often underutilized. And so I like to talk about it. I could talk about it all day, but for now, I'm going to pass it off to Kara.
Thanks, Jessica. I'm looking forward to doing this presentation with you today. Hi, everyone. I'm Kara McCaffrey from Houck. I'm owner and chief wellness officer at my family specialty construction company and work with KCA on their mental health task force a lot. I care a lot about mental health and also love EAPs and do a lot of promotion around it at my family company. So excited to talk to you today about how we do that at Houck and hopefully how you can do it at your construction company because I think EAPs are such a great way for people to get connected to help. So, what we're going to cover with you today is this agenda. I'll start with chatting about why mental health matters in construction, briefly talking about that. Hopefully, if you're here, you know that it matters already, but we'll touch on that to start. And then Jessica will go through an overview of EAPs, employee assistance programs, and really get into what they are, how they're confidential, the benefits of them, and talk through a lot about EAPs so you feel more confident about EAPs, whether you have one already or not. And then I'll go through from a construction company standpoint how we at Houck have communicated that and promoted it, and hopefully how you can effectively do that as well. And we'll also touch on the future of EAPs and end with some additional resources outside of EAPs just to make sure that you remember what's available to you as construction companies. So thanks to KCA and the Safety Committee for having us here today. Let me start with why mental health matters in the construction industry, just to touch on this. We all care about safety. So if you're here from the safety committee or you've heard about it from the safety committee, you know that safety is important in construction, right? Safety is critical in construction. And we often think about physical safety when we think about safety in construction, but mental health and physical health are integral in keeping someone safe and healthy. And mental health issues can affect physical safety. And here are some ways that they can. It can decrease someone's focus and their ability to focus, their thought process, their decision making as they're going through, their judgment, their concentration. So if someone's not thinking safely, and we're in a very physically risky and demanding field, and they take the wrong step or they do the wrong thing, that can cause an issue. So there's a higher risk for accidents, for injuries, for errors because of that decrease in focus and concentration when someone is struggling with their mental health. Mental health issues can also lead to an increased risk for substance use and substance abuse. And we know from a physical safety standpoint that we don't want people using substances when they're working in construction and they're anytime really, but especially when they're working, on the field, because that can lead to issues and to errors and to injuries. It can also lead to decreased productivity and efficiency if someone is struggling with their mental health. And that might not you know, think you might not think about physical safety when that's the case. But for me, when I think about it, if you have a whole crew and someone is not being as productive, they're not being as efficient, and then you have to get the job done, is the crew going to cut corners to make up for that time? Are they going to have issues in that realm? So I do think that that can impact physical safety if folks are trying to make up for that. And then also mental health issues can just lead to increased absenteeism. And when you look at the numbers just globally, not specific to construction, we lose so much money on folks being absent and also from lost productivity. It's somewhere around like 30 days that you lose because of both of those. The numbers are slightly off, but you really can lose money in that way too. So I don't like to focus on the money when I talk about this because I think it is more thinking about keeping people safe, but mental health is tied to physical safety. And so when we think about why mental health matters, it matters because of our physical safety in construction, but it's also more than that. On this slide, you can see the list of the top four OSHA hazards, which I'm sure all of us are familiar with. This is the common ways that folks die, unfortunately, in construction. But when you think about other ways that people die, there's suicide, and that is something that is impacting our industry a lot. If you look at how many work-related fatalities folks are dying in construction, around 1,000 per year, but when you look at suicide, it's somewhere between 5 and 6,000. The numbers aren't completely updated from the CDC yet, but it's definitely over 5,000 people who have died a year in construction through suicide. And if I added opioid overdose deaths to this graph, it'd be off the graph. So people are dying from suicide, from opioid overdose, and it's not 100% connected to mental health, but it is related. And so that's another reason why this matters so much. We want people to be safe, not just on the job site, but we want them to be safe at home and come back to the job site the next day too. Now, there are a lot of reasons why this is the case, and I'm not going to go into detail about these. There are additional trainings if you want to talk more about this or offline, I'm happy to. I want to focus on EAPs coming up next, but there are a lot of reasons and risk factors as to why this is the case in construction. Construction is the second industry out of all industries for rate of suicide death, and there are, as you can see, many contributing factors. We can't necessarily address all of these factors as construction companies. I hope that we try as much as we can to impact these and to decrease these risk factors and to take care of our people, to give them access to healthcare, to try to work out the schedule, to take care of them and to decrease the stigma that there is around mental health. But when we think about employee assistance programs and EAPs, EAPs are one way that we can take care of our employees and one way that we can take care of our people to help with some of these additional stresses and risk factors that construction workers have. I think it's a great thing to utilize to help with some of this. It's not a solution for everything, and we should dig into some of these risk factors and change our ways as construction companies to help with these. But EAPs are a great way that we can help our employees with their mental health and other stressors. So if you do not have an employee assistance program, Jessica's going to go through everything there is to know about an EAP. I hope that you consider after this presentation getting an EAP if you don't already. And if you're there listening and you have an EAP, but you're not telling people about the EAP, that's basically like you don't have one because people don't know about it and they're not using it. So I urge you all to make sure that you take away from this presentation. If you don't have an EAP, hopefully you consider one and make sure you're promoting it. So let's go through EAPs. Jessica, I'll pause and let you take it away from here.
Thanks, Kara. That was a really great setup for me to talk about the EAPs. So let's get into an overview. Today, we're going to define what is EAP, how can this help you as the employer, as well as your employees. How does this work so that we can demystify some of the ins and outs of the process? And the goal there is to make folks familiar with how it works so that they are comfortable in giving us a call or connecting online. And it is confidential, and we'll talk a lot about that as well. So what is the EAP? This is an employer-sponsored benefit. And so that means that the employer is paying for the cost of the service and the employee pays nothing. There is no copay, there isn't a deductible. In fact, it's not even connected to insurance. So if there are folks on your team who are uninsured, they can be covered through the EAP for mental health counseling and a variety of services. Not only is the EAP available to the employees, it's available to all household members. And I am speaking from my experience here with M&S EAP. However, most EAPs work in this fashion as well. So my little reminder here is to, like Kara suggested, get familiar with your EAP and what it has to offer, and understand who it covers and for how long. So by that, I mean our EAP covers all full-time, part-time, and seasonal employees, beginning day one, so the very first day they're hired, and for 90 days following termination. Whether that employee leaves on a good note or a bad note, the purpose for EAP at that time is to help through the transition. Any change is stressful, and this helps us as employers have some pretty difficult conversations because we care about our employees. Even if they're parting on not so great terms. So it's nice to be able to offer some additional support even after separation of employment. And the household members, we define in a very broad term. Basically, if they live under your roof, they're covered. So I like to joke around, even the dude on the couch gets EAP benefits. But in all seriousness, many folks are raising grandchildren in this time. And so there is some additional complication or complexity there. And again, we don't really care if it's by blood, by marriage. It doesn't matter. If they're under your roof, they're covered. And that's because this benefit, again, as it's sponsored by the employer, it's designed to help the employee in a very holistic way. So the EAP industry actually started out to help employees with substance abuse issues. And that certainly continues to be a big focus of our work. However, the industry has evolved significantly over the years to be more holistic, to include couples, whether they're married or not, families, again, intergenerational in nature. Kiddos as young as 4 years old are referred to EAP for behavioral issues. Once they start to get into school, sometimes there's a challenge with that adjustment period and teenagers. So it's not just for adults. We do spend a lot of time and care working with our younger generations. And as there is a growing sandwich generation, if you will, folks who are caring for, yes, their younger children and their older parents. So they're kind of sandwiched in the middle, carrying quite a burden. We have providers who specialize in geriatric care as well. So there's a broad variety of specialties. Anxiety and depression are the most common. But you could include neurodevelopmental disorders, mood disorders. Here we see stress, anger, and time management. So even if for example, if I'm not diagnosed with a mental health illness, I will certainly encounter stress in my life. And so there are providers who specialize in non-clinical support. And that would be through coaching, which I'll talk a little bit more about in a future slide. Grief, that of course impacts everyone. So this slide is just to give you a snapshot of some of the specialties. And my suggestion is if your employee or if you have a special request, contact the EAP. In most cases, if they do not have a provider that specializes in that specific area, they will go above and beyond to find somebody who does specialize in that area. So again, very broad in how we can help. It is a lot more than counseling, however. That is the bulk of our work. And we see a growing demand for elder care consultations. And this is designed a little bit differently because the consultation is for the employee to help their older loved one make some of these decisions at this older stage of life. And so that older person does not need to live in the household. Again, this elder care service is to help us help them. And so that might be questions with Medicare. I have a slide coming up that will, show all of the different elder care resources. Financial, same thing. Legal, we'll get into some examples of those as well. And I will share, again, just a plug, if you will, for coaching. Again, this is, something that can be utilized for professional development. If you're considering going back to school, or maybe you want to go for a promotion and you've been told that, there are some things that you can work on to be considered for promotion. A professional coach can help get you there. We also have coaches that focus on health and wellness. That's a huge growing demand. It's all about preventative care, how we can be healthy and live a healthy lifestyle before we get sick. And if we are diagnosed or we do have a chronic condition, health coaches can help us learn how to eat and exercise and support our wellness while we manage chronic care. Trying to think of other coaching options. Really, professional and health coaches are the most common, but there are life coaches, right? Folks who specialize in helping you determine, what do I want out of this grand adventure? And, that might be exploring hobbies, or it might be exploring spiritual development. So there's so much more than counseling. Here is the slide where I was referencing the different services that are explored with an elder care consultant. So this is, for example, if Great Aunt Betty in Kalamazoo is, maybe she had a fall. She went to the hospital and rehab and now she's home. But I'm Great Aunt Betty's person. And Great Aunt Betty calls me to, for help with decision making and guidance. Even if Great Aunt Betty is in Kalamazoo, I'm concerned about her health and safety, and a elder care consultant will help me to evaluate what are Aunt Betty's needs and what options are available to her in her local area. So that's just one example. You'll see several matters covered under this elder care service. And then we have financial matters, and this is not financial planning for the wealthy. This is not, I'm super rich and I want to keep it, or I want to give it to my grandchildren and future generations. This is more like, I'm in debt up to my eyeballs and I don't know how to dig out. And so we've had a lot of requests for this recently with the changes with the government, different funding that has been impacted, and families are being impacted financially, finding themselves in real sticky situations. So this service is to help guide through, at this point, what can we do? How can we deal with the creditors? And hopefully we can get people a little more proactive with additional education to promote budgeting and planning. Lots of resources there as well. And then finally, legal matters kind of rounds out this list of vendors that we offer in additional support services. And this covers every type of law except for employment law, because that would be a conflict of interest, right? But everything else, divorce, we see a lot of landlord-tenant issues, and the referral is to an attorney to help answer some basic legal questions like, is that legal? Can they do that? Do I need an attorney, or is this something I could perhaps manage on my own? There are additional resources online, and they have an interactive tool for creating wills and, for example, advanced healthcare directives. And so it, in an interactive process, will lead the client through a series of questions, including where do they live, so that they can generate documents that are binding in their jurisdiction, and provides guidance on how to make those legally binding. So again, lots of great resources here. Including under this legal umbrella, we also offer identity theft. That's a whole separate can of worms with additional services there. For the purpose of time today, I think that's where I'll wrap up those three different pieces and direct our attention to some work-life resources, because again, the whole purpose of the EAP is to support someone through anything that life can throw at them. Parenting, parenting, co-parenting, how to parent through divorce. It could be how to manage through life changes. So there are trainings and webinars and articles available online, typically through your EAP provider. How does it work? So when you contact us, we're going to gather some basic information, your name, your address, not because we're going to spam you, but because we want to identify resources that are local, not in Kalamazoo. We're talking right here at home. So we're going to get your phone number or email, depending on how you prefer to communicate. And we're going to ask who your employer is, or how is it that you have EAP benefits. And that's it. It is really that simple. People do not need to fill out an application in advance. They're already covered through your contract with the EAP. And that might be a little different, the process from EAP to EAP, but my experience has been most EAPs try to keep this as simple as possible to eliminate barriers. We want to make it as easy as possible for people to reach out and follow through to get the help that they need. And then we're going to ask for the nature of your call or your request. And some people will share their whole life story, and that's great. We are trained listeners, and some folks are just, short and sweet. They keep it simple. The idea is for us to gather as much information as possible to provide a really quality referral. And usually, if it's for counseling, for example, usually you'll have a few options, different providers that meet your criteria. And the way that it works for our group is you, as the client, schedule the appointments for the days and times that work for you. Again, trying to make this as easy as possible. And sometimes we know that it's challenging, right, to get an appointment. If you schedule with the dentist, right, they're usually talking several months out. And in mental health cases, that's just not acceptable. So if there is trouble scheduling an appointment, the EAP should provide that above and beyond service to help get an appointment as soon as possible. And now in 2025, post-COVID, I would say you should be able to get an appointment this week or next week. You should not be waiting for months. And if you are, it's a matter of, again, communicating with us, because that's what we do. We're here to help. So we will go above and beyond if, let's say, I experienced a tragic loss. The thought of calling around for an appointment might be crippling. Like I just might not even be able to do that today. And again, we're trained listeners. So when we pick up on those things, we can offer that service. As long as you have some availability, tell us the days and times that you are free, then we can look for an appointment and just make that again as super easy as possible. So it's really that simple.
And
Any
Jessica,
questions so far?
I was going to ask, and I think I know the answer to this, but I just wanted to confirm in case other folks are curious too. My understanding of employee assistance programs and them getting an appointment, once they contact you and get the options to call and schedule, that's typically a much faster connection and scheduling process than if they would go through their traditional healthcare insurance route and try to get a therapist that way. So one benefit to using the EAP for employees is a faster connection time, right?
Yes. That's because that's the service that we're offering. It's, that concierge service, if you will.
Great.
Yep.
Any other questions from folks? Feel free to put them in the chat or raise your hand and unmute.
I do.
Yeah.
Um, Question here. So, seems like a trend this year is peer-to-peer as far as mental health services and helping each other eternally, amongst the team. And you spent some time talking about coaching, but there's no connection. So peer-to-peer is totally different than EAP services. Is that correct? And
It's a connection. It is under the umbrella of services offered. And in a future slide, I will talk about the peer-to-peer service that we offer, but it is different from coaching.
okay, I'll wait for the future slide, and I might have additional questions. But you're doing awesome so far. Thank you.
Yeah. All right, then let's continue. The EAP is confidential. I cannot say that enough. So usually the way that I can convince people that this really is confidential is to kind of give them a sneak peek behind the curtain. So here's what happens when you contact the EAP. We create the referral. You, as the client, see the provider. Everything that you discuss, all of your records are the confidential property of the provider and you. That's your business. We at the EAP never even receive session notes, diagnosis codes, nothing like that. All we get is the bill. Okay, so the provider bills us and we pay them directly. And again, we work to keep confidentiality in every step of our process. So the health insurance companies will send an explanation of benefits, the EOB, to your home following visits. The EAP does not. You will never receive anything in the mail at your home. So the confidentiality is, yes, we have some protections in place to keep it confidential with the folks at work, but also at home in our process, because we sometimes don't want everybody at home to know that we're seeking support for certain things. So everything that you share is your private property. Nothing is shared with the employer except for some very generic numbers. And Kara can probably comment on this because, employers who care and really do put in the effort to promote the EAP, they want to know, like, what's going on? Are we helping people? And that's excellent. And usually we can just give some basic numbers. I wish we could share like real life success stories with detail that brings that value to life. We just can't, right? Because it's confidential. So, the only time that we would share any information with the employer is if there's signed consent, and that is usually only if there is a job performance referral, which we'll get to. Other than that, we are mandated reporters. So if you are a threat to yourself or to others, if there's a court order or if there's concern for child abuse or elder abuse. Those are the only times that we would break confidentiality.
And confidentiality, I think, is so important to employees. And that's something that when we promote it at Houck, we always talk about that. Not just that it's free to use, but that it's confidential. And to your point, Jessica, we do get data on like generically, are people using it for, a counseling session or did they go to the website? But it's all very generic information. It's no names, no specifics, but it is helpful for us as employers to know, are people actually using it? Are they speaking to someone? And it's so good to know if people are using it, but we don't get any information. So confirming, yes, confidential, and that's important.
Thanks, Kara. All right, so here we get to a few really important pieces for you as the employer. The EAP, is certainly designed to help the employees, and there are also services to support you. So, for example, if there were a tragic accident or a death on the job site, and even if it's not on the job site, if it happens over the weekend, off premises, but it would still impact, of course, the team and morale. Most EAP services provide critical incident stress management. And gosh, I could spend a whole day talking about that specifically, but that's designed to get people talking after the event, so that they can start to process their emotions, so they can process, what does this mean for us now as a team following this loss. It normalizes emotions and validates that all emotions are normal and valid following something tragic. And then we start to see some social support, caring for each other on our team. And if there is a concern for someone that might require some additional support services, the goal is to provide a very clear path to the EAP so that they can see a counselor for clinical care and clinical treatment. I've seen this just in an amazing way connect people and support people following tragedy. And it does a lot for the employee-employer relationship as well. So that's certainly something to look into now before it happens, so that you're aware, what you have as part of your plan. And then hopefully you'll never need it. The job performance referral is utilized quite frequently with companies that have a drug or substance abuse policy or have any sort of testing. And the idea there is to, again, support the employee so that they get the help that they need, and to provide an avenue for success. So, you can really customize and work this into your drug testing policy. But it doesn't have to be a substance abuse issue. It could be anger management. If somebody is just really struggling to keep their cool, as long as the issue is job related and we can connect it to performance or the position, then that would be appropriate for this job performance referral. And so what we do is document clearly, what is the concern, what's the issue, and then what are the goals, so that we have something very clear and specific. And then depending on the nature of the report, they are connected to a provider that will help through that process. And the goal then is that they're released from the referral and they have the tools and the practice and the support to be successful. Sometimes, however, it doesn't work out successfully, or the employee doesn't follow through. And in that case, there would be cause for your next action. So it could be termination. You could terminate employment, or maybe it's a 90-day suspension or a performance improvement plan. So this is kind of like the last straw effort. Like, we've tried so many things, and now we're kind of at that point where we have to attach some pretty serious consequences. Or it could be that the violation or the issue is so egregious that you've kind of skipped over all of the prior steps and you're right here at a job performance referral. Here again, this is certainly not something that people want to share or publicize, but I've seen some really great success and turnaround here. People have said to me, at first I was really pissed off about this, right? And they fight really, really, really hard. And then they're like, but thank you, because, it really did make an impact in their life and save their job. Yep. Um, and then there's the organizational and professional development services. That's what I focus on most these days. And that is if you have two supervisors in conflict, and let's say they're both really great and valuable employees, and it's a real problem because they're in conflict, what do you do? The EAP has professional coaching and development services available. It could be training. Just last week, I did a training for a construction company on harassment. It could be communication. There's a whole variety of topics that we train on. Conflict management is a big request. And then also these professional development services are, for example, let's say you promoted somebody into a leadership position and they have the skill and the knowledge, the industry knowledge. However, they might not have the leadership skills and the soft skills quite yet. This could be a good option for them to develop better soft skills. And we can work that into like a program. For example, we have one company, they call them the emerging leaders. And so they identify folks on their staff that are showing promise and potential. And so as a cohort, they go through this training process so that they're, well equipped once they're in those leadership positions. And so the EAP really is designed to help the employee, but also you through some of those employee relations issues. So, Kara, am I talking on this one?
I can talk through this one if you want. I think it's kind of really, you've already touched on a lot of this. It's basically saying if you have an EAP now, learn what it offers. All the things that Jessica just covered, does your EAP have that? It might, and you might not know. It might offer critical service support, but you didn't know about it. And knowing about it in advance of a tragedy is so helpful. Like, look at what you currently have. And if you're considering maybe you don't have an EAP and you're considering purchasing one, some of the things here, everything that Jessica just talked about, think about those things. Ask the EAP, if they have these services. And cost obviously is a factor. We're businesses, so we need to think about how much money this is, but also think about all the things that Jessica just touched on and think about, how many sessions. So I know at M&S EAP, there's a flexible model, so you can get up to 12 sessions for free, but different EAP providers might have different formats. So think about, how many sessions you get. Think about how long. Jessica mentioned, a week or two, typically you can get in to see someone, but if an EAP provider, doesn't have that fast of a turnaround, maybe that's something to consider. And test it out. Like call them yourself and try to see how it's working, how it works. And so you better understand it and can promote it and try it out for yourself. I think you've kind of touched on all of these things. The one thing maybe you could go through is that access to care and like the different ways to get support. Did
Yeah.
you talk about your website?
I didn't. Thanks for reminding me. Yeah, so my recommendation is always call. Now I know sometimes that's not always convenient, but if it is something urgent in nature, the best thing to do is to call us because you will always talk to a live person. Um, So during business hours, the calls are answered by our team. After business hours, we have a service. It's like an answering service on steroids. So they're able to provide referrals, very basic referrals. They are able to provide crisis support in the moment. And so that's a big thing. Crisis doesn't happen Monday through Friday, 9 to 5 only,
Yeah.
right? It's usually when nobody's around, that's when you need support. And so our service is available 24 hours a day, 7 days a week to provide that immediate support with a master's level clinician. So this is not peer-to-peer. This is a clinical provider. So that's my recommendation, just as kind of blanket, make a phone call. However, I'm very busy, and so usually it isn't until like 9 o'clock at night when I finally have time to prioritize me and my self-care. And so it might be something like go to the website and submit a request through the website. And so there you're just providing some basic information, and then we will follow up with you by phone or email, whatever you choose. Some folks have an app. We do not have an app. However, I learned from my kids, gosh, how embarrassing, that you can, and I got step-by-step instructions, you can make a website pinned onto your phone. So sometimes I will share that with groups that want an app because our website is mobile friendly. So there, it's really easy to just pin it onto your home screen and you can click for support. So yeah, there should be a variety of ways for people to get access to care.
Thanks. Yeah, these are things to think about when you're evaluating your own EAP or for a new EAP. And we do have a slide two next. Let me show you this. And Jessica, if there's any others you want to add to the list, these are some EAP vendors that we've heard of or worked with. MNS EAP is Houck's provider, and we have a really close relationship. So that's why Jessica and I are doing this together. But this is not an exhaustive list. There are other EAPs out there. The EAP that you have might be amazing, and that's great. Just make sure that you're thinking about these things that Jessica just talked about. Build Well, formerly known as U-Turn, I think is a more app-based version. Canopy, I think, is construction-based that I've heard of. I haven't dealt with them, so I can't really say like official recommendations because I haven't worked with that one specifically, but these are some other EAP vendors to consider. If you have any others, feel free to put it into the chat for others to see too as we go along. But that's EAPs. That's an overview of what employee assistance programs are and how they can support your employees. Are there any other questions at this point before I turn it over to myself to talk about the construction company's perspective? Yeah, John. Oh, no, no. Okay, not yet. Okay. I saw your hand raised, but it went back down.
Oh,
Just
sorry.
trying.
Sorry, I was on mute.
Oh, okay.
I
Do you have a
started
question?
talking. Yeah, I started talking and I was on mute. Sorry about that.
That happens.
Um, when it comes to confidentiality, um, what do you do or how do you react if you hear from workers or whatever like they don't feel like they could trust it, they don't feel it's confidential? Is there a message or like a approach that you can work through the supervisors just to kind of build your trust or whatever? And just wondering if you've been in a situation like that.
Yeah. On the call today, I think we have Anthony. Let me see if he's still on. Yeah. So
Yeah.
Anthony Galati on our team is the account manager for Houck. And one of the strategies is to introduce the account manager to the employees so they can put a face to the name. We start to build a relationship and, just having that person makes people feel comfortable, like, okay, I might not be able to trust the EAP, but I can trust Anthony, right? Like they feel comfortable making that contact. Another strategy is to, as it's appropriate, share personal stories. A lot of our folks are recommended by a coworker. And the coworker has shared something like, I'm really sorry that you're going through this, don't forget, we have an employee assistance program. I used it last year when I was going through my divorce, for example. So just those personal stories and encouragement. This is certainly a top-down strategy. It has to come from the top. And I think that might be why Houck has seen some real significant growth because of Kara's support and messaging. I think we're going to talk a little bit about stigma, so I'll stop there. But my recommendation is just keep it personal. Have them contact and ask hard questions, like if they're not sure, they don't remember what the process is, ask before you share any of your information. Get curious. Um, yeah, I think that's how I would sum that up.
I think those are great suggestions. And I love the word of mouth thing too. Like the more people who use it and can tell people about it, I think that breaks down the stigma and the fear. And then every communication always really mentioning about the confidentiality about it and being like, no, really, like it is. And I love your comment about the top-down importance of like people talking about it, not just me, but supervisors and others. I think the more word spreads, the more people trust it. But that's great. Thanks, Jessica. All right. Let's move into how construction companies can use and promote the EAP and end on this in our final time together. So I'll share some things that we've done at Houck. There's other things that we could do. I always want to improve. So if you have ideas for us, please let me know. But I can share some of the things that we've done and some suggestions for you, really to integrating it into your culture, both from an HR perspective and also a safety perspective. I feel like are two key areas that it's easy to kind of incorporate it into. So let's start there and talk through how to incorporate it into human resources because HR is all about people, right? Sharing benefits and communicating and messaging that out and making sure that our humans, our employees feel supported and they have the right support and help. And so there's different things that you can do to promote the EAP in the HR world. One is just thinking about when people start in their onboarding process. Do you tell people about the EAP right away? We talk about all of our benefits in onboarding, but I have a special slide now in onboarding that talks specifically about the employee assistance program and how to use it, what it's used for. And I think that first connection with someone, letting people know, hey, we care about your health, we care about your mental health, all, your safety, your mental health, and really putting it in and letting people know right from the beginning is important. Any kind of communication around benefits, healthcare insurance, vision, dental, any kind of benefits you have, also communicate your EAP. If you have different benefit campaigns throughout the year, make sure that you communicate it in that way. Open enrollment is a great time too. Jessica had mentioned how the EAP is separate from your healthcare insurance, and it's for all full-time and part-time employees, regardless if they're on your healthcare insurance. So I think open enrollment is a good time. Remember, regardless if you're signing up for our healthcare, you have access to our EAP. You and your family have access to it. Do you have an HR platform or site that people go to find documentation? Make sure that you have overviews of the EAP. We have one in English and in Spanish posted in our HR platform. So when people go and look for their paycheck or look for other important documents, the EAP is right there and they can have easy access to it. How can you incorporate the EAP and educating people about it in ongoing training? We've had webinars before too about it. So how can you teach people in the benefit and in the training side of things? And then with safety, I think there's such a big connection. We talked earlier about the importance of mental health and how that impacts physical safety. Educating people about your employee assistance program when you think about physical safety, it's such a clear point to me to connect those two together. So if you have toolbox talks, this is a picture of me doing a toolbox talk with one of our roofing crews on our employee assistance program, our little healthy toolbox talk. So can you do, a toolbox talk on mental health instead of just ladder safety or fall prevention? Incorporate this topic into toolbox talks and then always remind people about the EAP. If you have stand downs or safety meetings, how can you remind people about it there? Safety training. Make sure if you have an annual safety training or quarterly safety training, remind people about it. Do you have job trailers or job sites or break rooms, not just for field workers, but office workers too, because the stress, the mental health issues, the life experiences that cause us, stress, that's for everyone, right? It's not just field workers, but are there places that you can put up information and if you have a safety board or something and a job site trailer, put up a poster of an EAP there. Just try to get it out in different ways. I think the simpler you do it, just the more you do it, it normalizes it. You never know when someone might need that information. So how can you connect it into some of these things that you're already doing? And then also drug related, and Jessica touched on this too with substance use and drug related, at Houck, we're a second chance drug company. We do have a drug policy, we test, and we want people to not do drugs. But if someone has an issue, we want to get them help. We want to get them to a healthy place. So we utilize our employee assistance program to get people connected to the help that they need. And we use the EAP in that way too. And our safety team manages all of that. So that's another way to incorporate and use the employee assistance program when we think about safety. And regardless if you're putting this information into HR initiatives or safety initiatives or just general company initiatives, depending on how big or small your company is, we need to communicate it. And we need to communicate it in different ways, multiple times throughout the year. And you know your employees best, so you know how they might get the information. They might read texts more than they read emails. Everyone might be a little bit different, but I think it's important to communicate in different ways because different people do like to absorb information in different ways, and they might not need the information when you give it to them the first time. But if you continue to address it and promote it, they might need it in a year from now. And if you are doing it over time, not just like a once a year thing, they're going to be able to remember, oh, wait, Kara did tell me about that EAP, or oh, I did hear that about that EAP from the safety team. Let me look into it. So multiple ways, multiple times. Posters, emails. For us at Houck, we have electronic newsletters that we send out quarterly around health topics. So we always promote it throughout that. We do hard mailings. I think that's a really important one to bring it back to the family. If you send an email to an employee, they might not tell their spouse or their kid about it. But if you send a hard mailing home about, hey, your whole family has access to this EAP. We did this for Mental Health Awareness Month. Then it gets to the family. Can you do webinars, give out cards? I went to a session recently where a company puts little EAP wallet cards in the restrooms because it's a private place for people to grab rather than out in the open, which I thought was a great idea. You'll come up with other ways that you want to communicate it. Point is, do it in multiple ways and try to spread it throughout the year. Here are some examples of when it might work. KCA in Pennsylvania does the Construction Opioids Awareness Week in July. That's a great time to remind people, hey, if you are having an issue with opioids or you know someone who's struggling, remember our company has an EAP. Construction Suicide Prevention Week is another great time to talk about EAPs. We're actually writing a toolbox talk on EAPs. So maybe next September you can do our toolbox talk on EAPs. And then Construction Safety Week too. So communicate a lot in different ways. And I can show you how this helped with us at Houck. So this is old data because I want to show you how quickly communication can help. You can see from 2021 to 2023, we had a half a referral a month. And then I started in September of 2023. We always had the EAP, but we didn't really talk about it. I started in September. My first email out to everyone was, here's the EAP. It's Suicide Prevention Month. Remember that there's support out there and it's okay to use it. Within just a few months, you can see the change that it made. We had it, but we didn't communicate it. So you can really quickly get more usage, but it's all about communicating in different ways multiple times. And I don't have data to prove that like us using the EAP more has helped with physical safety necessarily, but I do have testimonials, and these are all anonymous, of people who have used the EAP and have had benefit to it. And that's the most important thing to me is impacting people's lives and them finding help. They found help with their mental health. I won't go through all of these, but it touches on it's confidential, it builds trust. And the last one, I was so happy when I saw this. They referred it to someone else. They told someone else that they had used it. And that just warms my heart so much that they've told other people about it. And it goes back to Jessica's point about that word of mouth and kind of demystifying it. So this is how what we've done at Houck and how we've seen success. Let's touch really briefly just on the future of EAPs. I know we're running out of time. We just have a few minutes, and some of this we've chatted about. But Jessica, do you mind just going through what you kind of see as coming on board, and we'll see if there's other questions at the end?
Yeah, I'd love to. So you will probably hear more about the EAPs embedded in your health plan and long-term disability. So, it might be a budget decision. If you don't hire a standalone EAP, my recommendation is to check with your health plan. Peer support and technology apps. So I'm a very visual person. If we could just take a look here at the next slide, our EAP is embedded with Capital Blue Cross. So check your plan. Depending on what plan you have, you might have us and not even know it. So that's one resource, definitely. Then I would touch on Kindly Human. This is the peer-to-peer support. And across the board, peer-to-peer support is growing in industries like the construction industry and in companies. But this is a much broader and general peer-to-peer support, again, to provide support not just for the employee, but for the entire family. And these folks are trained listeners and peers. And so they're able to spot red flags and suggest clinical intervention. But, sometimes you don't need that. You just need somebody to listen. And that's what these folks do. So, yep, that's certainly coming up in the future, as well as apps. Everybody wants an app. And so here's one that we work with, Sworkit. And it is a really cool tool to integrate some movement and physical health with your mental health offering. And that's exactly where you're going to see this industry grow. As employers recognize the 8 dimensions of wellness and how this is all working together to support employees who then support the bottom line. So this is one of the apps, but
There's
gosh,
probably
there are
others out there.
so
Yeah.
many out there. Yep.
Yeah. But this just shows like this is what's coming with EAPs and how they can integrate into things. So, all right. To wrap up, just to remind folks, there are so many additional resources besides employee assistance programs that you can use that are specific to the construction industry. Here are some of them. Please check out Construction Suicide Prevention Week, CIASP, and then KCA has a lot to offer as well. There have been so many different webinars through our wellness library that the Mental Health Task Force put together. Thanks, John, for all that you do for this. So there's links here. I'm sure John can send out this when we send out the recording. So there's even more to learn besides today. There's national organizations too, and I think we'll end with just a thank you. Thanks to John and the Safety Committee at KCA for having us. I hope that you found value in learning more about EAPs and how you might be able to promote it. If there's questions, feel free to ask, and you can always contact us later. Thanks, Jessica. This was so fun to chat about EAPs with you today.
Yeah, thank you. Like I said, I could talk about it all day, and I'm happy to hang on if anybody has a question afterwards, or again, to connect one-on-one. I know maybe a public audience isn't the right time to ask your personal question, so please reach out.
Yeah, do we have any questions? We did start about 5 minutes late, so we still a couple minutes on the 1 hour clock here, so 1:05. So
Yeah, feel free to ask questions if you have
yeah.
any.
The only thing I was wondering is I get a sense, and I've heard that younger generation and younger workers don't use EAPs as much. Do you have any strategies that have worked? Is that true for starters? I guess that's
I
part
haven't
one.
heard that. I don't know. Jessica, have you heard that?
Um, it really, my experience has been each company is different because of the culture, and it's not so much the demographics. Like here we have Houck, and typically the construction industry is a harder industry to encourage participation in mental health support and resources. But it's really all about the company and the support and communication from the leadership. So I think
Yeah.
that's, more than generational. I think it's
Okay.
just about the culture at the company.
And that reminded me too, for utilization to give people a like a standard. I think normal standard utilization for EAPs is somewhere around 5%, if I'm correct. But then like
Mhm.
construction is even lower than that for reference for Houck. I just did this math for the year so far for 2025, and ours is around 12 to 13%. So I think it does, it really matters how your culture is and if you're promoting or not. If you have an EAP but don't talk about it, no one's going to use it.
Yeah.
Yeah.
Other questions?
No, I want to thank you guys, first of all, for having us on. I'm Patty from ProA. I work with Nikki. And, a lot of the things you're talking about, I'm kind of old school, so I know a lot of unions in my family, and they didn't talk about all of this. So I love how you said you had one slide initially, and now you got training topics all over. So the EAPs that I know do have some kind of a plan in place. What they're doing with it, with the unions, I'm not sure. But we're going to do a whole lot of work to find out. So I really thank you very much for all this.
Yeah, thanks for
Appreciate
being here.
Thank you.
And that's one thing since COVID 2020, I've seen an uptick from the unions as far as usage of EAPs. Too bad it took a pandemic to utilize this great service, but
Yeah. And
any
that's a
other?
good reminder too. If a company is part of a union, maybe their company doesn't have an EAP, but the union that they belong to has an EAP. So same thing goes of testing it out, making sure is it good? Because if the union EAP isn't good, then you as a company might want to offer something additional. And I've heard of other construction companies doing that, especially if they have multiple unions for different trades, because then it's confusing for an employee to know which one to call if there's a lot of different EAPs because of different unions. So I do know of an HVAC company who recently purchased an EAP so they could just have one number and it'd be consistent and easier to remember to support employees.
Okay, and the last second questions. I thought this was awesome, very informative. The resources are amazing. The information was top notch as always. Kara always delivers, and I'm glad I got to meet Jessica. Thank you so
Thank you
much.
very much. This was excellent. I
Yeah.
appreciate the opportunity.
Thanks, everyone.
God
With
do it
that, on
all.
behalf of the KCA, thank you.
Thank you all.
Thanks, John.
Thank you.
Take care, everyone.
Bye bye.